Hello, you're welcome to my platform. I am Dr. Sandra Nabukalu and I am a surgeon. I hope you become aware and sensitized about the different surgical conditions. Today's video is about lupus vulgaris. Lupus vulgaris is a medical name that is given to a skin condition that occurs as a result of infection by a bacteria called Mycobacterium tuberculosis. Although there are other bacteria that cause this condition, for example, Mycobacterium bovis, Mycobacterium xenopi, Mycobacterium tuberculosis is the commonly implicated bacteria. You might be familiar with TB of the lungs, tuberculosis of the lungs. When tuberculosis, that is TB, occurs in the skin, that is what we call lupus vulgaris. When we have the infection, this time round occurring in the skin, that is when we get lupus vulgaris. The reason why I wanted to discuss this condition with you is because this condition tends to present itself in a variety of ways. For example, it can present in a given way in one of the patients and in a different way in another patient. You know, there are some conditions that you can easily spot a diagnosis because they tend to present the same way in all patients. But for this condition, it presents differently in different patients. There are so many different ways it can present itself, especially on the skin of the patient. And for this reason, it can easily be misdiagnosed. For a very long period of time, the patients can undergo different treatment modalities without any cure to this condition because it presents itself in so many ways. This is why I wanted to discuss it with you such that you can easily know the different ways it can manifest itself. And the other reason I wanted to discuss this condition with you is its ability to disfigure patients. It tends to disfigure, cause disfiguring effects to the patients, and it is because it takes a long time without proper diagnosis. And to repeat, it is because it has so many ways of manifesting itself. So I want to discuss for you the different ways it manifests itself and also, of course, the other things about it. In order for you to end up with lupus vulgaris, that is TB of the skin, tuberculosis of the skin, the bacteria has to be introduced into your skin. It can be introduced from the outside or from within your body into the skin. When it is coming from the outside, it can be introduced via a minor injury, for example, tattooing of your skin, a piercing on your skin. It can also be a minor injury or a major injury from maybe a road traffic accident, or it can be from within your body. For example, you already have tuberculosis of the lungs, the infection within your lungs, and then this bacteria can reach your skin via blood. And when it reaches your skin, there are some things that can change. For example, there's going to be a recruitment of the cells of the immune system into your skin. For example, the macrophages. The macrophages are the cells of the immune system that fight bacteria. So they are going to come and eat up, swallow the bacteria. And this can result into more recruitment of the macrophages. The macrophages can undergo some changes. They can form the giant cells, they can form epithelioid cells. We can also have recruitment of other cells of the immune system, for example, the dendritic cells, the lymphocytes, eosinophils, and this is just an attempt to wall off the infection such that the bacteria that does not go to the rest of the skin or the rest of the body parts. And when this happens, the walling off of this bacteria from the rest of the body will form a swelling. and this swelling is called a granuloma. That is just a medical name we use for this swelling that is formed by an attempt to wall off the bacteria from the rest of the body. And all these activities, all these changes are occurring within the second part of the skin, that is the dermis. However, on the first part of the skin, the epidermis, these changes are going to be seen as swellings protruding through the skin. These swellings are referred to as apple jelly nodules. They are called apple jelly nodules because they look like they have the color of the apple jelly. That is why they are called the apple jelly nodules. But please just know that these are just a reflection of what is happening in the second part of the skin, and they're just going to be seen as bumps, as swellings on the upper part of the skin, the epidermis. As time goes on, there are some changes that can occur within these apple jelly nodules, the nodules that you'll see on the skin surface. They are going to start expanding, and as they expand, the center will become thin and the outer part will look expanded or enlarged. And with time, they are going to join together to form a plaque. It is just like a skin lesion, and we usually call it a plaque. A plaque is just a swelling that is formed as a result of a union of these smaller swellings. Now let's talk about the different manifestations, the different ways this condition is going to present on your skin. You can have what we call the ulcerative presentation or the ulcerative type. This will manifest itself by a formation of an ulcer just in the middle of the plaque, of that bigger swelling formed by the union of those smaller swellings. You're going to have formation of an ulcer, and this ulcer is going to be unique in a way that it will look like there is space under the skin. The skin is going to hang into the wound, into the ulcer. This is because the infection tends to eat up the fat layers of the skin while leaving the skin intact. And so you're going to have that picture of an ulcer that has skin that is hanging into the ulcer. And majority of the time when you can even pass your finger, you can easily feel like there is a tunnel just under the skin. And we call that undermined edges. But that is how it looks like. Majority of the time, it's like there is a tunnel just under the skin, below the skin. It is because this condition tends to eat up the fat layers, leaving the outer part or the upper part of the skin, forming what we call the undermined edges of the ulcer. You can also have what we call the psoriasiform type. In this presentation, you're going to have multiple plaques. That is, you're going to have larger swellings that are formed by a union of those initial smaller swellings. They are going to be multiple in number, many in number, and the outline of the plaques are going to be irregular, that is not smooth, but also they can be oval in shape. And the floor, when you look at the lesion, they are going to be covered by scales. They are going to be scaly. They are going to have some whitish tissues on the floor when you look at the plaques, those lesions. So please look out for that. If you see that on your body, it can actually be TB of the skin. You can also have another presentation called the nodular type. This presents as multiple swellings that are surrounding a given lesion, and this lesion, majority of the time, its center is having a thin skin. That is, the skin looks thinner than the surrounding skin, the rest of the skin. So if you see a lesion on your skin whose center has a thin skin, sometimes shiny, and it is surrounded by some small swellings, it could point to a possibility of TB of the skin, that is lupus vulgaris. Please look out for that. There is also another type called the erythematous type. This one manifests itself as reddening as well as scaling. So you're going to have a picture of reddening at the base and also some scales just on top of that reddened lesion. And it is usually between 2 to 5 centimeters. So if you see a lesion of that nature on your skin, it can point to TB of the skin, lupus vulgaris. Please look out for that. You can also have another presentation called the hypertrophic type. This will present as a plaque on your skin that has some hardened tissue. It will also be tender, painful when you touch it. There will be crusting of that plaque. A crust is that hard tissue that forms, especially when you get injured and you're healing. There's that hard thing that forms on top of the wound. It is called a crust. In this presentation, it will also be present, and it will be tender when you touch it, painful when you touch it, and there will also be some projections coming out of that lesion in form of thorns. Please look out for that. It can be a presentation of the TB of the skin, that is lupus vulgaris. You can also have another presentation called the sporotrichoid type of presentation. This usually manifests itself as small swellings in combination of ulcers. So you'll have ulcers in some part of the lesion and then swellings in another part of the lesion. It can point to TB of the skin. Please look out for that. You're also going to have another presentation called the annular type. This one presents as a lesion on your skin that has an irregular border, an irregular outline, not smooth. It will not look smooth, but the inside of the lesion is going to be hardened. It will have some hardened tissues. When you touch the lesion, it will be hardened, but not crusted. Just the tissue is going to be hardened. It will even be darker than the surrounding skin. So when you see a lesion on your body of that nature, it can actually point to the annular type of lupus vulgaris. Please look out for that. You will also have another presentation called the giant lupus vulgaris. This one presents initially as reddish brown swellings that are flat. Majority of the time they are flat, but when you touch them, they are going to be soft. They will be small at first, but they grow in size as time goes on. They are usually reddish brown and flat patches, and they are soft on touch, but they become bigger with time. Please look out for that. Please also look out for enlargement of your lymph nodes. And the other thing that I want to tell you about this condition is that it can transform into cancer. 8% of the time, it can transform into cancer. And 30% of the time, if the condition began on the skin, it can also go to the other parts of the body. For example, the liver, the lungs, the bones. The commonly affected sites in lupus vulgaris include the face, the ears, the chest, the hands, the forearm. You can also have it on the legs and the feet. In some patients, it can also occur on the buttocks. So please look out for any lesions on those areas of your body. The individuals that are commonly affected by lupus vulgaris include the male gender. The males are 6 times more affected than the females. People in a lower socioeconomic status, people that are young, especially from 18 months to before puberty. Surprising enough, This condition affects people that have a moderate to high immunity, unlike other conditions that tend to invade our bodies when our immunity is low. The investigations that we carry out in lupus vulgaris include a complete blood count, we do ESR, CRP, we do a chest X-ray, a high-resolution CT scan of the chest or of the bones. We also do a tuberculin test. We also do a biopsy, a punch biopsy, where we carry out some studies. We can do tissue smears, we can do histopathology, we can do PCR, we can also do culture. And all these attempts are to find out if we have any evidence of infection with tuberculosis, Mycobacterium tuberculosis, such that we can establish a diagnosis and then we can initiate treatment in these patients. When it comes to the treatment of lupus vulgaris, we always give you medications that kill the bacteria. And this is done for a minimum of 6 months. Depending on how you're responding to treatment, we can either stop at the 6 months or we can proceed. We split these 6 months into 2 phases. The first phase is called the intensive phase, where we give you 4 medications, that is rifampicin, isoniazid, pyrazinamide, and ethambutol, taken 3 days in a week for the 2 months. And then we switch to the continuation phase, where we give you rifampicin and isoniazid, and this is also taken 3 days in a week. You can choose Monday, Wednesday, and Friday. When it comes to the prevention of lupus vulgaris, we always recommend that please avoid inoculation. Reduce the chances of inoculation of the bacteria into your skin. This can be done by avoiding walking barefoot, avoid causing intentional trauma to your body, for example, tattooing. Please be aware of your environment such that your body is not traumatized, and also take the necessary precautions to avoid injury to your body. Please also manage your environment by proper ventilation of your environment. Please also exercise good hygiene by covering your nose. If you have TB, please cover your nose and also your mouth when you're coughing. Wear a mask. And when you're around people that have TB, please always wear a mask. We also recommend that you seek medical attention on time, such that we can establish a diagnosis and start the medications on time, start treatment on time, such that the disease does not spread to the rest of your body, or it does not spread to other people. Yes, that is what I had for you. Thank you so much for listening to me. Please share my videos and also subscribe. See you in my next video. Bye.